Hi, I'm Dr. Deepti Jain, and I'm a board-certified orthopedic spine surgeon. I see patients every day who have severe back pain, and patients always ask me, what is the difference between acute pain and chronic pain? Well, the answer is that there is no really definition of this. There are lots of definitions that are out there. Some say it's a matter of time duration, meaning 6 weeks versus 3 months versus 6 months. We do have some definitions out there that do actually quantify that as 3 months. What I see very commonly amongst patients is what we call acute-on-chronic back pain. That means patients who've had back pain or episodes of back pain, that back pain gets worse in what we call an acute period, let's say under 6 weeks. And that is just very, very common. That's something that I see all the time. If patients present with primarily low back pain, that tends to be what we call axial. In other words, it can be a sprain. It can be from the muscles, the joints in the back of the spine called the facet joints. It could be from the disc. And all of those things can get lumped into discogenic pain, facetogenic pain, myofascial pain. Now, if you might have symptoms that go down to your legs, or let's say you have neck pain that's going down your arms, that's when we start to think about nerve-related symptoms. And those could be things like the nerve roots could be pinched, the entire thecal sac, the entire sac of nerves can be pinched, and those cause this other set of symptoms that include pain and symptoms going down the buttocks and the legs and the shoulders and the arms. The reality is there are lots of definitions that are out there. Typically, what I use is 3 months to define acute versus chronic. But some sources will say 6 weeks, some sources will say 6 months. What I actually do see really frequently is what's called acute on chronic back pain. That means someone who's had back pain for a very long time. However, they have this acute episode where their back pain gets a lot worse over a short period of time. 80% of Americans will experience these episodes of acute back pain throughout their life. There's something called natural history. In other words, just how symptoms tend to progress. And so when patients have an acute flare-up of back pain, very frequently it is actually just a matter of time for a lot of that pain to improve. So I have patients, I have friends who come to me and they say, Dr. Jain, you don't understand. I've never had back pain and my back pain is just so severe. And I tell them, okay, we're going to treat your back pain today. We're going to start with some physical therapy, some medications. Maybe I can give you an injection today. But I bet if I see you back in 2 weeks, more likely than not 100% of patients, obviously, but more likely than not, your pain is going to have improved. Now, in someone who has pain for a longer period of time, we just know based on history and studies that that pain is more likely to stay for whatever reason. And that's when we start thinking about other types of interventions as well.